Hi, everybody. I'm Dr. Michael Richmond, double board certified cardiothoracic surgeon. So last August, I made a video talking about Ehlers-Danlos syndrome, and I received a tremendous number of questions and still do to this day. But in particular, many of you have asked about genetic screening. Who should have it and when should they have it? So today we're going to talk about that topic. So the question that I'm asked is, if you have a known family history of EDS, should you have genetic screening? So the simple answer is not everybody with a family of history of EDS requires genetic testing, but testing is strongly recommended in first-degree relatives when a pathogenic variant has been identified in the family. And that means vascular and classic EDS subtypes mainly. This decision depends on the specific EDS subtype, as I just said, the severity of the condition, and whether the variant is known. So when should it be performed in first-degree relatives? Well, for vascular EDS, genetic testing is appropriate even in the absence of clinical signs, as early identification allows for surveillance to begin early and regularly, awareness of potential complications, and restrictions of high-risk activities. And those of you who have been diagnosed or have a family member know what those are. Testing can be performed in childhood, as 12 to 24% of individuals with vascular EDS experience a major complication by 20 years of age. And recent evidence emphasizes the importance of offering genetic testing in childhood when there is a family history of vascular EDS, as diagnosis allows for follow-up surveillance, informed multidisciplinary management, and lifestyle modification, which is extremely important. Now, for classic EDS, it's appropriate to clarify the genetic status of apparently asymptomatic older and younger at-risk relatives through molecular genetic testing of the known familial pathogenic variant to identify those who would benefit from early treatment and preventative measures. Many of you also have hypermobile EDS, and genetic testing is not currently available. As you know, the molecular basis remains unknown. Diagnosis relies for this type of EDS on clinical criteria. So where should you get it? Next question. Genetic testing should be performed through accredited clinical laboratories that offer EDS gene panels or targeted testing for known familial variants. Testing should ideally be coordinated through genetic counseling services, so you need to seek that out at a specialized center or a tertiary care facility with expertise in connective tissue disorders like Marfan or Ehlers-Danlos. The optimal timing is before pregnancy for family planning purposes. So with that, hope you learned something today. Thank you for listening. For more information, guidance, advocacy, or a consultation, you can go to my website at www.paladinmds.com and have a great day. Thanks.